Good morning. I am David Cade, CEO of the American Hla Association. Welcome to our 2020 annual meeting. Before I introduce Rob Niccolini, AHLA's board president, who will report on the state of the association, I'd like to share a personal message with you. This has been a very difficult period for all of us. COVID-19 has turned our normal routines upside down. And around the world, people have raised their voices to denounce racism, injustice, and inequality following the senseless murder of George Floyd. We are even more disturbed that this tragedy is not an isolated incident, but it is yet another example of the racism and inequality that has plagued our nation for centuries. This is a difficult time for us, and you are not alone in struggling with this situation. As the events of the past weeks have unfolded, I find myself grappling with a myriad of emotions. As I watch peaceful demonstrations and hear anguished cries for justice that have been raised in this country for centuries, I have thoughts that not much has changed in this country, and I am frustrated. Like many of you, I have learned to keep my emotions inside. Yet my reality is full of pain and sadness as I reflect on my own experiences, those that have impacted my family, and those that I see daily on the news. The image of Mr. Floyd brought back images of my sister-in-law's murder at the hands of a self-proclaimed white supremacist not too long ago. There's space for all of us to be angry, to grieve, and to give voice for change. Even though no one is immune from the impact of racism, hatred, and indifference, I believe in Nelson Mandela's words. In 1994, he said, "No one is born hating another person because of the color of his skin, or his background, or religion. People must learn to hate, and if they can learn to hate, they can be taught to love. For love comes more naturally to the human heart than its opposite." You see, there is a cure to the disease that has fostered health, income, and education disparities in this country. An African proverb says, "Too much tolerance paves the way for trouble." In other words, you will never change what you are willing to tolerate. To remain silent and tolerate racism means that racism will continue. We as an association are committed to advancing diversity, equity, and inclusion within our association and the health law community we support. We further condemn the inequality that exists in our country and the world. AHLA has and continues to move forward initiatives that advance our diversity, equity, and inclusion efforts, and continues to look for additional ways to bring our community together and do our part in the fight to end systemic racism, injustice, and inequality, and to expand on issues related to health disparities. Last year, we amplified our efforts to have greater diversity and representation in leadership and in speaking and author opportunities, and we are making progress. We have expanded diversity and inclusion and unconscious bias education. In fact, the board and non-board leaders will receive additional training this year. We will continue to work aggressively with our leaders to offer content about health inequities, discriminatory health practices, and racial disparities that impact our community and the health status of those who receive less than. In 1965, Martin Luther King Jr. said, "Our lives begin to end the day we become silent about things that matter. Now is not the time to be silent. Never be silent." Thank you. Now, it is my distinct honor and privilege to introduce to you Rob Niccolini, AHLA's board president.
Thank you, David, and thank you for your heartfelt words and perspective as our country faces these agonizing times. As the president of the AHLA, and quite frankly, as a father, a husband, and simply a human being, I've been horrified by the events I've witnessed over the last month. We join in your hope that the current pain we are experiencing as a country may serve as a catalyst for effecting lasting change. And we at the AHLA pledge our support to help effectuate that change and to ensure that racism is never tolerated, period. Now, I have had the unique honor of serving as president of the AHLA over the last year, a year marked by both challenge and by change. I'm excited to welcome all of you to our 2020 American Health Law Association's virtual annual meeting. And some of that challenge and change I just mentioned is evidenced by the fact that we are virtual and that we can't all be in San Diego as originally planned. That said, we are still grateful and excited to come together as an association and to remind ourselves that the AHLA is more than just a gathering of people. We are, at our heart, a community of colleagues and a community of friends, and no pandemic will ever stand in the way of that. As in past years, the agenda for this year's annual meeting is extremely rich. Your colleagues have packed a tremendous amount of substantive content into the 3 days we have together. Pretty much anything and everything you wanted to know about the legal, compliance, and operational issues facing the healthcare and health law industries will be addressed during our coming conference. Before we begin with the substance of the program, though, we have a bit of AHLA business to take care of. The bylaws of the AHLA require that the membership hold an annual meeting each year so that we can report to you the state of the association. So with that said, I'm now calling the AHLA annual meeting to order, and there being a quorum present, let us get started. A chat function, by the way, is available for any questions you may want to ask. I am pleased to report that despite all the challenges 2020 has brought, our organization remains financially strong. I am most grateful for the AHLA's legacy of strong leadership and conservative financial planning, which has allowed us to be well positioned to weather COVID-19 and its impact on our economy. I started my presidential year with 3 main goals: implementation of the new board committee structure, better defining and delivering the value proposition, and the AHLA 2030 task force. I want to take a moment to touch on our progress this last year on all 3 of these goals. First, in FY 2019, we changed our governance structure to enable the board to be nimbler and more efficient, while at the same time large enough to permit representation by a diverse group of directors that reflects the constituencies of the AHLA. In addition to newly focused committees on education and governance, we raised up the critical importance of diversity and inclusion to the board level with the creation of the Membership Diversity and Inclusion Committee. And we also formed a Development and Advancement Council this year to determine how best to support the association's educational mission. My goal this year was to facilitate the successful implementation of the new structure, and I can report without hesitation that the new streamlined committee structure is up and running and is serving the association well. Second, with respect to better defining and delivering our value proposition, I've always viewed the value of our association through the lens of service to you, our members. With that in mind, we have simplified and streamlined our dues model, rebranded ourselves as the American Health Law Association to broaden the tent for more inclusivity of all those involved in health law, and refreshed and revamped our website and member portal to improve member access and information sharing. It's been a very successful year, and here are just a few of the highlights. This year, we had over 2,300 paid registrants for webinars and over 7,800 registrants for all distance learning events, which was an increase of 11% from the previous year. We offered over 3,100 publications this last year, including over 50 podcasts. And even though we had to cancel 2 in-person programs and postpone a convener session on artificial intelligence due to the pandemic, we still offered 10 different programs with over 4,500 attendees. The AHLA staff worked with the Transactions Conference Program Planning Committee to convert that conference to a virtual experience. And that virtual conference proved that we could do it again successfully for this very meeting. So although we cannot be together in person, please know that we will always be here to serve you, whether virtually or otherwise, and that you will always have access to our exceptional educational content on demand. As to my final goal for this year, The AHLA 2030 Task Force was chartered to help identify anticipated changes in the health law industry in the coming decade, and to recommend how AHLA could remain relevant to its members and consumers in light of those changes. The task force identified several important trends, including increased competition to provide health law services, increased consolidation of providers, increased technology spending that's transforming how we offer health law services, and the growth of in-house legal departments. The task force has now presented its final report to the board, and we anticipate incorporating their important work into upcoming strategic planning. Know that in the coming years, the AHLA will be active in addressing all of those identified trends with additional educational content, convener sessions, and discussion forums, and that we will continue to evolve as an association to meet the changing needs of our members. We have used this podium many times over the years to remind you that if you are involved in health law, you have a home in AHLA. We think the return on investment that our members receive from their AHLA membership is significant, but we know we could not do it without all of you, our leaders, our members, and our volunteers. We are a richer and more vibrant association when everyone participates and when everyone is valued. So we sincerely hope that all of you will remain active, because in the end, you are what makes AHLA truly great. Personally, I want to thank the board, the staff, the members, and all of you for making the last year an amazing one for the AHLA and for myself as well. It has been a true privilege to serve this association, and I believe that I end my term as president with the AHLA remaining strong despite all of our challenges and positioned for a bright future. So with that, I bring this annual meeting of the membership to a formal close by introducing our incoming president, Mr. Craig Holden. For those of you who don't know him, Craig is a shareholder in the Baltimore office of Baker Donaldson, where he serves on the firm's board of directors. His practice focuses on fraud and abuse and other regulatory matters for a wide variety of healthcare providers and manufacturers. Craig has been an AHLA member for over 30 years. He is a frequent speaker, an active donor, and a mentor. He has served the association a variety of leadership roles over the years, including as program planning committee chair and board member. This year, as president-elect, he chaired the board's governance committee and the annual meeting program planning committee, and he planned our current superb annual meeting. And perhaps most of all, Craig is a lawyer you can truly rely on, and a friend who's always there for you, no matter what. So, without further ado, please welcome our new president of the AHLA, Craig Holden.